welcome to Moms on Mics. I'm Joanne,
I'm Cash.
And I'm Sophia.
and this episode, we're talking about the thing our moms didn't talk to us about, that the generations of women before us never warned us about. It sneaks up on us and drags us into a hot flash of hell, perimenopause and menopause. We hear the words whispered and occasionally people complaining about symptoms, but it's something that seems to be a secret. Like this terrible surprise we're gonna get whether we like it or not. Kind of like our periods, I guess. That was a shocker. So let's talk about it. According to the Mayo Clinic, perimenopause is the time before menopause, when your body is getting ready to stop having periods. Perimenopause is sometimes called the menopausal transition. Women start perimenopause at different ages. You may notice signs such as your periods becoming irregular, sometimes in your 40s, but some women notice changes as early as their 30s or as late as their 50s. During perimenopause, estrogen, the main female hormone in your body, rises and falls. Your periods may get longer or shorter. You may skip ovulation, which means your ovaries don't release an egg. You also may have symptoms such as hot flashes, trouble sleeping, and vaginal dryness.
Once you've gone 12 months in a row without a menstrual period, you've reached menopause and perimenopause is over. But that's just the basics. It's not that simple. During perimenopause, you may notice changes in your body. Some changes are subtle and some are more obvious. You might have irregular periods. As ovulation becomes more unpredictable, the time between periods may be longer or shorter. Your flow may be light to heavy, and you may skip some periods. If the length of your periods is consistently different by 7 days or more, you may be in early perimenopause. If you go 60 days or more between periods, you're more likely in late perimenopause. If you go 12 months without a period and then start bleeding, talk to your healthcare professional right away. This could be a sign of a health issue. Hot flashes. Many people have hot flashes during perimenopause. Hot flashes can vary in how strong they are, how long they last, and how often they can happen. Sleep problems. Trouble sleeping is often due to hot flashes or night sweats, but not always. Changes in sleep patterns can happen in perimenopause even without hot flashes or night sweats. Mood changes. Mood swings, irritability, or increased risk of depression may happen during perimenopause. Mood changes can happen for other reasons that are not related to perimenopause. For example, people with a history of hormonal mood changes such as premenstrual syndrome, premenstrual dysmorphic disorder, or postpartum depression are more likely to have mood changes during perimenopause. People who have had mood disorders in the past, such as depression or anxiety, are also at risk. Vaginal and bladder problems. As estrogen levels drop, your vaginal tissues may become drier and less elastic, causing pain during sex. This dryness also can cause burning when you urinate. Even if you do not have a urinary tract infection, it can also make you more likely to have urinary or vaginal infections, and you might leak urine more often, need to go more frequently, or feel a stronger urge to go. Decreasing fertility. As ovulation becomes less regular, it's harder to get pregnant. However, if you're having periods, pregnancy is still possible. If you don't want to get pregnant, use birth control until you've gone 12 months without a period. Changes in sexual function. During perimenopause, sexual arousal and desire may change. Some women may not enjoy sex as much, while others enjoy it more. If you are concerned about your sexual health during or after perimenopause, talk to your healthcare professional. Loss of bone. As estrogen levels lower, you start to lose bone more quickly than you replace it. This increases your risk of disease that causes fragile bones called osteoporosis. People with osteoporosis are at risk of bone breaks. Changing cholesterol levels. Less estrogen may lead to changes in your blood cholesterol levels. This can include an increase in low density lipoprotein, LDL, cholesterol, also called the bad cholesterol. which increases the risk of heart disease. At the same time, high density lipoprotein, HDL cholesterol, also called the good cholesterol, decreases in many women as they age. Together, these changes increase the risk of heart disease.
Doesn't it sound so exciting? No wonder no one fucking talks about it. Like,
No, I
Christ.
just, we went over that, you may pee your pants more. Like, well, I pee my pants all the time, and I'm not in perimenopause.
Right? So many of these symptoms
It's
are
actually,
so like also symptoms of being a woman who's had a baby.
yes. And it's true, or just being a woman,
Yeah,
right? Period.
exactly. Like you
So,
might be moody. No shit, we're fucking women. We're gonna be
yeah,
moody. Like, I get it. Like before all you women get mad, we're not moody. We're moody.
we're
We are.
moody.
Like, and I get that it's not our fault. It's hormones, but this is saying we're gonna fuck with your hormones 10 times worse than we do already. So yeah, we're gonna be cunty. We're not gonna be
Yeah.
moody. We're gonna be cunty.
Everybody's moody though. Even men are
Right?
moody.
Oh,
Like,
100%. Yeah, like I by no means am saying only women are moody. I'm saying watch out, men. We're gonna be extra moody. This is the one
yeah.
thing I'm actually looking forward to because I can be like, fuck off. I'm not moody. I'm perimenopause. I have an excuse for being cunty. This is great.
So the physical symptoms are listed as breast soreness and tenderness, tinnitus, ringing in ears, acne, weakened pelvic floor, incontinence, breathing difficulties, wheezing, breathlessness, irregular periods, a change in your usual cycle pattern, flow, and length, hot flashes, sudden intense feelings of heat, often with sweating and redness, night sweats, hot flashes that occur during sleep and can disrupt sleep, vaginal dryness, lack of natural lubrication, which can cause discomfort or painful sex, loss of libido, decreased interest in sexual activity, fatigue, persistent and unexplained tiredness or low energy, mood swings, rapid, unpredictable changes in emotional state, anxiety, feelings of worry, nervousness, or being on edge, depression, persistent low mood, sadness, or hopelessness, irritability, increased frustration or short temper, brain fog, difficulty concentrating, mental fogness or confusion, memory lapses, forgetfulness regarding names, appointments, or tasks, sleep disturbances, difficulty falling or staying asleep, insomnia, weight gain, particularly around the abdomen due to hormonal shifts and metabolism changes, bloating, a feeling of fullness or abdominal discomfort, headaches, migraines can become more frequent or severe, joint pain, aches, stiffness, or discomfort in the joints, muscle tension, general tightness or soreness throughout the body, brittle nails, nails that become weak, chip, or break easily, thinning hair, hair loss or changes in texture, dry skin, reduced collagen and moisture can lead to dryness and itchiness, itchy skin, unexplained skin itchiness, often related to dryness, dizziness, occasional bouts of lightheadedness or balance issues, heart palpitations, a fluttering, racing, or irregular heartbeat sensation, electric shock sensations, brief shock-like feelings, often in the head or just under the skin, tingling extremities, sensations of pins and needles or numbness in hands and feet, burning mouth syndrome, a burning, scalding, or tingling feeling in the mouth or tongue. Never heard of that one before.
Right?
Gum problems, increased risk of bleeding gums, dryness, or other oral issues. Digestive issues, problems such as gas, constipation, diarrhea, or acid reflux. Changes in body odor. Hormonal shifts can alter natural scent. Changes in taste. Food may taste different or taste less appealing. Increased allergies, new or worsening allergic reactions due to immune system changes. Urinary issues, frequent urination, urgency or stress, incontinence, leaking urine. Recurrent UTIs increase susceptibility to urinary tract infections.
Again, does this not sound just amazing?
That was a really long list. And I'm that. I'm that. I have that. I do that. Oh, I'm like
Right?
that. Oh,
Like,
that's me. Me. But I'm like, I'm not in menopause.
right? Well, here's the thing. So they give you, when you look it up, they give you like, this is your basic, like, what, five or six things. Like, oh, you might get this. And so people are like, oh, okay, well, menopause doesn't sound too bad. Like, the deeper you look into it, it's like, wait a minute, you could also have all these other ones that we're not going to tell you initially because we don't want to scare you. But
Yeah.
like, they're fucking horrific. And again, a lot of them are just symptoms of being
A woman.
female, right? Like women, we suffer, man, so much sometimes. Okay, so brain fog for women in peri and menopause is more than just being too tired and not remembering things or struggling to keep up. It can definitely come from insomnia, but more than that, it comes from losing estrogen, means losing the chemical that is responsible for our executive function. So causing memory loss and making decisions makes it difficult, which is why brain fog is so hard for us. A good night's sleep doesn't take it away, especially as a good night's sleep for those in peri and menopause doesn't usually happen anyway. And this is something that will last for years. It's why we can walk into a room and forget why we came in, why we can forget words mid sentence or even forget the whole sentence. Goddamn, the amount of times I
Right?
do that. I have been known to be yelling at my kids, and it's also an ADHD thing too. So I've been yelling at my kids or yelling at my husband, and then like mid yell, and I'm like, wait, what were we talking about again? And they're
Why
like,
am
for
I mad at you
fuck's
again?
sakes. Yeah. So apparently it just get worse. So that's exciting for them to look forward to. There is an aspect of grief women can feel during peri and menopause. We grieve the person we used to be. We may not recognize ourselves anymore. There's stress, anxiety, and depression that comes with it. 1 in 10 women have suicidal thoughts. 20% of peri and menopausal women are clinically depressed. Cortisol spikes at night cause anxiety, which causes insomnia, which ultimately causes the fog. So it's just a vicious fucking cycle of horrendousness. The loss of estrogen levels fluctuate the most at night, and that causes cortisol spikes that affect anxiety and also affect the area of the brain that regulates heat, which is where the hot flashes come from, which causes insomnia, which leads to memory loss and brain fog. The estrogen is also a natural lubricant, so the more we lose, the more our joints become inflamed, which can cause the frozen shoulder that can last for 3 to 4 years. I had a friend, or have a friend, that got the frozen shoulder horrific. Like just one day everything is normal, the next day her shoulder's frozen and she can't move it properly. And there's nothing they can do, really. Like you can go to physio to try and help make it feel better, but can you imagine just suddenly waking up one day and you've lost the function of your shoulder? Your fucking shoulder. Like,
Crazy.
right? And being told, I'm sorry, honey, it's just you're in perimenopause. Fuck off. It's also responsible for weight distribution in the body, especially in the belly. Thanks a lot. Weight gain that's out of our control, no matter how much we work out or how little or how much we eat. You know, this shit just pisses me off, man. We had our fucking periods, then we have the babies, and now we get this shit. You gotta be
Yeah.
kidding me. I swear to God. If there is the whole heaven and everything, it better be so fucking cushy for women up there. We better not get nothing. No shit, no nothing.
That's why sometimes I feel like people don't realize how much our bodies really go through
Right?
in a year, like, or not in a year, in a lifetime.
Exactly. And men just be like, "Aw, you on your period? Is that why you're bitchy? Fuck you, dude." Like, this might be a little bitchy episode. Everybody, I'm so sorry. This shit's
I'm
pissing
actually
me off.
I'm actually scared for menopause because of my blood disorder.
Oh, yeah. Well, I guess that would mess with that, wouldn't it?
It does. It makes it go too high.
Oh, and it fucks with our ADHD and autism. So there's that too.
Oh, you guys are screwed. I'll be over here living the dream.
You'll just be having the normal hot flashes. We'll be like, we're fucking nuts.
I mean, I'm already practicing getting ready. I don't sleep very much at night. The hot flashes.
That's just it. Like, so those types of things are very much ADHD related, right? Like, we don't sleep. We can be up all night and it's just the way it is. So now you add the extra shit of this on top. I don't know.
Losing estrogen and testosterone causes our sex drive to go down, which can cause intimacy issues. Estrogen, being a natural lubricant, means when our levels drop, we can get vaginal dryness, which can make sex painful. The cortisol spikes make it really hard for us to relax too, so the combination makes being intimate difficult. Estrogen also affects our ability to make melatonin. So when our estrogen levels drop, we struggle to sleep. And it's not just that we wake up a couple times a night. For some of us, it could mean we don't sleep at all some nights, literally awake all night. Then we still continue with our day with work, kids, cleaning the house, doing laundry, cooking, all the things as we normally do, only without any sleep at all.
That's a huge thing, right? Like, I've always heard people say, oh, I didn't really sleep last night. But then what they actually mean is they just woke up a couple of times, right? Like, I know myself, Cash, you probably are the same way. There's some nights that you literally do not sleep. Like, you're in bed and your eyes are open and you're awake and you're conscious the entire night. So I don't know how many men we have listening, but when your wife said she didn't sleep last night, be nice because she probably didn't sleep at all and then functioned all day with a smile on her face because we're moms, so we've got to be nice. And I mean, we work with kids, right? We can be happy and playful and hear them tell the same horrific joke all day long. And it's fine. We still laugh every time on zero sleep. So I just think people need to understand how big that actually is, like how much of an issue that is. Like, it was one thing, in your late teens and 20s, we were out partying all night, we got no sleep, and we worked the next day. No big deal. You're also 20. Now add your mid 30s, mid 40s, 50s. You need more sleep because your body, it takes so much extra work to do the normal things. But now you didn't get any sleep. And then your husband comes home. What's for dinner, honey? Fuck off. Be prepared, man. Read the room. Learn to read the room way better.
For many women, these changes can feel like they happened overnight. They can come on suddenly with little to no warning. And if we didn't know that it was coming, we can be blindsided by it, making us feel like we are losing our minds. We go to the doctor and they tell us it's anxiety, or every doctor's favorite explanation, you need to lose weight. So many women are made to feel like it is all in their heads or they are making it up. And this isn't the 1950s when doctors would prescribe women a variety of happy pills for their energy and weight loss, and barbiturates and minor tranquilizers, downers like Milton for anxiety and stress. These were often referred to by the tongue-in-cheek nickname, Mother's Little Helper. Common cheer-up pills. Instead of a single cheer-up pill, women were often given different types of medications depending on the desired effect during various parts of the day. The happy pills.
Amphetamines.
These stimulants are prescribed to provide energy, combat fatigue, and act as appetite suppressants for weight loss. Barbiturates. These acted as sedatives to treat anxiety and insomnia caused by the pressure of post-war suburban life. They had a high potential for abuse and dependence. Minor tranquilizers. Milton. Meforbamate was the first blockbuster tranquilizer introduced in 1955. It was marketed as a safe and effective way to alleviate tension and become incredibly popular, with tens of millions of prescriptions written by 1956. Valium diazepam was approved in the early 1960s and later surpassed Milton in popularity. These medications were often given without a full understanding of the long-term risks of dependence and were a common, albeit problematic, solution for social and emotional stresses in the mid 20th century, which peri and full menopause was usually misunderstood to be.
Okay, the shit pisses me off so much when I was reading about this. I've always heard of like the cheer up pills, right? But basically, men would take their wives to the doctor and say, she's a little chubby or she's not so happy. And the doctor would give them a fucking pill. So, like, here's your antidepressant pill and stuff because they want it like it was the 50s, right? So, we want our women beautiful and barefoot, possibly pregnant, in the kitchen with a smile on their face when I'm out at work doing my men shit, fucking my secretary, what men did, right? All that shit. And so they got their cheer up, bitch pills, and it's such bullshit. The women probably did have anxiety and depression because, man, fucking the secretary and being a
Yeah.
jackass and women had no rights, right? Like, so we didn't have, and I'm not being all like, we are women, heroes roar, but this shit is bullshit that happened to women. And the sad reality of it is it still happens just by the doctors. We no longer need our husbands to take us to the doctor to get our cheer up pills. We just now go to the doctor and they give it to us by themselves, right?
Yeah.
So instead of looking at, well, what are your symptoms? What else is going on? What other things do you have? They just say, well, here, you've got anxiety. The anxiety is the blanket diagnosis. It's our new cheer up bitch pill. And like we just get pills for it when most people probably have something else going on. Or they're just a little anxious. That's okay. You can be a little anxious and not need a pill for it. It's just there again, part of being a woman. We just because we've got so much shit going on. It's not necessarily that we need a pill. We just need help. We need our village back, right? Our villages have gone. Everyone proudly states it takes a village. Where the fuck is the village? Like, where did it go? And
Mm-hmm.
if you are in someone's village and you try and help them or you like give them some advice and they're like, fuck you, you don't know shit, right? Like either
Yeah.
the village has disappeared or the village is not allowed in. So women need to go back to working together, helping each other out, and just, I don't know, just don't go to your doctor all the time, man. It's just, they don't always know shit. You'll just get a pill. Sometimes it's a little yellow, happy pill.
So why now, in 2026, do doctors still not have a solid understanding of peri and full menopause? What are the reasons for the knowledge gap? Limited medical education. A significant factor is the lack of formal education in medical schools and residency programs. In one survey, 80% of medical residents reported feeling barely comfortable discussing or treating menopause symptoms, and only a small percentage of OBGYN programs offered dedicated menopause training. As a result, many physicians are not equipped to recognize the wide array of symptoms as perimenopause related, often misattributing them to other conditions like depression, anxiety, or stress. Varied or vague symptoms. Perimenopause is a transitional phase with over 34 possible symptoms beyond the commonly known hot flashes and irregular periods, all of which can also be symptoms of other conditions, thyroid issues, fibromyalgia. This overlap makes accurate diagnosis challenging. Fluctuating hormone levels. Perimenopause is characterized by wild and unpredictable fluctuations in hormone levels, estrogen and progesterone. Not a steady decline. This means that a single blood test may show normal hormone levels one day, leading doctors to dismiss real symptoms. Diagnosis relies more on a patient's history and symptoms than a definitive test. Insufficient research and stigma. Historically, women's health issues, particularly those related to midlife, have received insufficient research and industry emphasis. Deep-seated cultural stigma and a perception that women should suffer in silence has also contributed to the topic being a taboo for many years, preventing open discussions between patients and doctors. It's true.
Yeah.
Time constraints. Primary care physicians often only have short appointments, around 10 to 15 minutes, which is rarely enough time to evaluate complex and multi-system symptoms that require a detailed discussion of a woman's history.
When I was doing research for this, I decided I would take my labs, like from the last couple of lab tests that I had done, and put it into Chat GPT to see. I was like, oh, I wonder if I am in perimenopause because the last time I went to my doctor, he said no. So I put it into Chat GPT because I'm like, let's see. And it said no also, but I was like, I wonder what else I could put into there. So I started putting other lab results into it. It came up with, like, have been told I am pre-diabetic for about 3 years now. And I was like, oh, I'm going to put those numbers in, see what happens. Chat GPT comes back, nope, that's not pre-diabetes. And I'm like, what the fuck? What else could it be? So I decide to put other ones in, and it's like, you have hypothyroidism, which is often misdiagnosed as pre-diabetes. And I
Oh.
was like, what the fuck? And I remember telling my friend once that I didn't understand the whole pre-diabetes thing because I cut sugar out for like a whole week and my levels were through the fucking roof, but I didn't have sugar. I'm like, that's bullshit. And so then I was like, well, fuck this shit. Nothing matters. I'm just going to have sugar again. So I had sugar like normal and my levels dropped. And I was like, what the hell? That's not normal. Like, I have the home test thing that I test every morning. I'm like, that makes no sense. So I was trying to research, and it's like 0.1% of population that has this weird blood thing. I'm like, that's not it. So then when ChatGPT came back and said, like, hypothyroidism, I was like, huh. So I kind of put that into it, and they're like, yep, that absolutely can be it because your thyroid fucks with your blood sugar levels, basically, and it makes the readings all weird. And I was like, oh, amazing. But then my whole point of the story is because then underneath it said, would you like me to write out what you need to say to your doctor to advocate for yourself? And I was like, well, fuck yes, please. I absolutely want you to do that because I know for myself when I go to the doctor, I'm going to be like, oh, I had a thing. I think it's a thyroid, not a diabetic thing, but I'm not going to remember everything. So basically, ChatGPT went through all of my lab records that I'd put in and came out with this whole spiel basically for me to tell my doctor,
Mhm.
which I was like, that's amazing. So, my hint to everybody listening, because we have like 5, 10 minutes if we're lucky with our family doctor, try putting your symptoms into ChatGPT, see what it comes up with, or even just putting into ChatGPT, can you tell me how to advocate for myself with my doctor regarding whatever it is that you want help with. And it basically typed out a whole thing to say this, and this. Like it's a whole explanation. But then it says you can also print this off and hand it to your doctor. Why not? Right? Like why not use these tools that we now have, like this technology that we have to help advocate for ourselves? Because Lord knows, females, we have to advocate for ourselves with our doctor because I don't know about everybody else, but the amount of times I've been told maybe I need to lose weight by my doctor is infuriating as somebody that's 5 foot and 120 pounds.
Yeah.
It's infuriating. And I get it. Okay, I should be like 105 to 150, whatever the fuck. I'm not overweight by any means. And the amount of times my doctor has said, maybe you just need to lose some weight. So give it a try. See if it helps. If you're having trouble finding the words, advocating for yourself, give it a
Yeah,
try.
that's great. I'm gonna go put all my stuff in Chat GPT tonight.
Right? And I mean,
See
because
what it says.
that's just like we get our lab results and we're trusting these doctors that we've seen for 5 minutes are going to tell
Yeah.
us what's going on. And they don't, right? Like, it's not that they don't know how to do their job, but they're so fucking overwhelmed by the amount of patients they're trying to fit in. They don't,
What is the app called again?
my health records. Because some of the lab results, I don't know what that means, right? Like it doesn't say this test is for your thyroid, this test is for this. Like it's got the whole like medical terminology and all that stuff. And it does say on there like normal, not normal, but it's more than just that. It been increasing over the last 5 years or 3 years or whatever? Has the level
Yeah.
changed? Has it dropped? Has it raised? Whichever way, right? And so once you put them in there, so I did the last 4 years of lab results, and that's how I got that.
Do you also look at the graph?
I do, but unless you understand that it can increase a certain amount over a certain amount of time, and that's okay, versus it increased too much over that certain amount of time, like unless you really can understand and read those, you don't know. You're going by the doctor saying, oh no, you're fine. And the doctor's just looking at those labs right in front of them. They're not necessarily looking at your last 5 labs. They're looking at the ones they've got. So if the numbers on the ones they've got say normal range, then they're like, nope, you're fine. But there's a window in that normal range for most labs, right? Like,
I probably just have a different doctor because of my blood disorder. So mine
yeah,
has to look at the number because I also have to make sure that my like the iron absorption is under a certain amount, which is normal to you, but not to normal to me.
yeah,
Right? So I know how to read those, but I had to learn how to read them.
yeah. But even if, like, so my thyroid levels, it was within like normal range, but it had increased within that normal range still.
Mhm.
And because it had increased a certain amount, because even the chat GPT explained that, even though it's within the normal range, it has increased significantly over the last 3 lab results or whatever, how many it was. That's what the concern is, because it should not continue to go up. Certain things can go up and down a little bit, but some should not. It's
No,
a good tool. I think it's just something women should know that's an option out there. Like if we don't understand what our labs are saying and we don't know how to advocate for ourselves, there's a tool out there that will help us. Which I mean, my doctors never suggested that. And I'm guessing most doctors won't because it's just like you don't want to have Dr. Google, right? You don't want to Google your symptoms because Google will always tell you you're dying of cancer, right? Regardless, even if you have a sprained ankle, you're now dying of cancer. Like that's what
yeah.
Google does to us. But this
Yep.
is a tool that will take all the information you give it, and the more information you give it, the more helpful. And if anyone's concerned, your health records are already online. It's not hurting anything.
Right.
And they're there literally hours after you get your
Yeah.
blood work.
Yeah, they are.
Make sure you do at least like the last 3 lab tests kind of thing, and it'll tell you if there's anything you should be worried about.
Yeah. So in Alberta, only 3.4% of research funding is allocated to women's health, which is lower than the national average of 8%. Globally, only 1% of healthcare investment is directed toward women-specific conditions, with Canada slightly better at 4%. This indicates a significant gap in funding and attention compared to men's health.
Typical. But also, can we just take a second to note that med students, when doing their residency, were uncomfortable discussing menopause symptoms? Fuck off! You're in med school. You're gonna be cutting shit open. I watch Grey's Anatomy. You're gonna have your hands inside people's bodies. But you
Yeah.
can't talk about a hot flash, you big baby. Okay, so perimenopause significantly affects attention deficit hyperactivity disorder, ADHD, by worsening existing symptoms or unmasking previously well managed and undiagnosed ADHD. This is primarily due to the decline and fluctuation of estrogen levels, which are closely linked to the key neurotransmitters involved in ADHD, such as dopamine and serotonin. Key effects of perimenopause on ADHD: worsening of symptoms. Women who have existing ADHD diagnosis often find their symptoms, which may have been manageable before, become much more harder to control. Late diagnosis. Many women who are only diagnosed with ADHD during menopause, when symptoms become severe and disruptive, leading them to seek medical advice or what they might initially believe are just menopause symptoms. Symptom overlap. There is a significant overlap between perimenopause symptoms and ADHD symptoms. Example, brain fog, forgetfulness, difficulty with organization, emotional dysregulation, anxiety, sleep issues, making it difficult to determine the exact cause of a symptom without a professional assessment. Common symptoms that may worsen: the combination of perimenopause and ADHD can lead to a double helping of certain symptoms, including increased forgetfulness, frequently misplacing items like keys, phones, or forgetting important dates or tasks, brain fog and concentration issues, significant difficulty focusing, mental fatigue, and problem with multitasking, emotional dysregulation, heightened irritability, mood swings, feeling of overwhelm, anxiety, and low mood that can be difficult to manage, executive dysfunction, greater trouble with planning, time management, organization, and initiating or completing tasks, management and treatment. The interaction between perimenopause and ADHD can be managed with professional support and lifestyle adjustments. Medication adjustments: your healthcare provider may need to adjust your current ADHD medication dosage, as lower estrogen levels can affect how effective stimulant medications are, which for ADHD people really fucking sucks. It's so hard to find the the right medication and the right dosage, and when you get that sweet spot, you just want to stay there forever. And when you can't, it fucks you all up. Hormone replacement therapy, HRT, can help stabilize estrogen levels, which may in turn alleviate some cognitive symptoms and mood swings related to the hormonal transitions, potentially making ADHD symptoms more manageable. Therapy and coaching, bullshit. Sorry, I fucking hate this bullshit. Therapy and coaching does not help with ADHD, man. Like, you can tell me, I'm gonna cut this out, but you can tell me until you're fucking blue in the face how I should handle situations. It means shit until I'm in that situation. And if you're not there telling me, hey, no, calm down, relax, this is whatever, right? I'm not gonna remember your fucking coaching because we don't remember shit. It drives me nuts. Let's just get a therapist. How about you fuck off? Okay, I'll do that again. Therapy and coaching, cognitive behavioral therapy, CBT, and ADHD coaching can provide effective strategies for managing emotional regulation and executive function challenges. Lifestyle changes, regular exercise, a nutritious diet, and stress reduction techniques like mindfulness can help improve cognitive function, sleep quality, and overall mood. Understanding the combined impact is the first step towards finding relief and the right combination of treatments. Don't forget weed. Weed can help.
You see me in the
Find
corner, just
what?
leave, you see me in the corner, just leave me alone.
Right? Honestly, weed can help, and not necessarily the THC. You don't have to get high per se. I mean, it's always a bonus if you can, but even just like the stuff without the THC, it can help with, especially with regulating your emotions and keeping you nice and calm and that stuff. Christmas would not have been the same this year without my gummies. Just saying. Everyone else, you're welcome.
Perimenopause can significantly affect autistic individuals by intensifying existing autistic traits and making the management of both menopausal and daily life symptoms more challenging. The hormonal fluctuations and physical changes can feel overwhelming, sometimes leading to a perfect storm of difficulties that overwhelm previous coping strategies. Specific impacts of perimenopause on autism. Heightened sensory sensitivity. Autistic people may find their sensory sensitivities to noise, light, touch, and temperature even more intense during perimenopause. Hot flashes and night sweats can be especially distressing due to temperature regulation difficulties. Worsened emotional regulation and mental health. Mood swings, anxiety, and depression are common in perimenopause, but autistic individuals are more likely to experience these intensely, sometimes leading to increased meltdown, self-harm, or suicidal thoughts. Increase, increase executive,
Executive.
ex, increase executive,
Executive.
executive function challenges. Perimenopause can cause brain fog, memory problems, and difficulty concentrating in all women. For autistic people who may already struggle with planning, organization, and multitasking, these cognitive changes can severely impact their ability to work and perform self-care tasks. Breakdown of coping mechanisms, masking. Many autistic women mask their traits to navigate social situations. The increased stress and exhaustion of perimenopause can make maintaining this masking impossible, leading to social withdrawal or their autistic characteristics become more apparent. For some, this has even led to a late in life autism diagnosis. Difficulties with interoception and physical symptoms. Autistic individuals may have atypical interoception, difficulty recognizing bodily sensations like pain or hunger. This can result in either overlooking significant physical symptoms or being intensely fixated on minor aches and pains, making it hard to identify and communicate health needs effectively to doctors. Challenges assessing healthcare. Autistic women often report difficulties with navigating healthcare systems, making appointments, and communicating their symptoms to professionals who may lack awareness of how autism affects the menopausal experience. This can lead to inadequate support and sense of isolation. Understanding these unique interactions is crucial for seeking appropriate, tailored support. Resources from organizations like the National Autistic Society can provide valuable guidance.
Isn't this supposed to be me next?
Yeah. Yeah, I realize that. My bad. Yeah,
Okay.
it's crazy how like we don't always feel pain the same as other people, right? Like when you're autistic, you don't like my son broke his hand and he had no clue. And I'm like, why is your hand like 3 times the size of normal? He's like, oh, I don't know. And he still can't move. Like this was years ago. He still can't move the fingers properly because he didn't
Oh,
go
crazy.
get it checked. I'm like, dude, yeah, we call it a not appropriate name, but we have this like crazy pain tolerance. And it's funny because I'm like I can injure myself or be really sick or whatever. Like when I broke my knee, I was like really can't walk, but it didn't hurt, but I just couldn't walk properly. And I was like, this is really fucking annoying. I can't walk on it. And they're like, what's your pain? I'm like, it's probably at a 2, but I can't walk. That's my problem, right? But then I could like stub my toe and feel like I have lost my lower half of my body because it hurts so
Right,
bad. I'm like,
that's
I don't
me.
understand.
Right. I broke my foot and refused to go get it looked at and just walked around on a broken foot for months.
Yep.
But then if I stub my toe, I'm like, I need to go to the emergency room.
Right? Same. I
Because it
broke.
hurts so
Oh,
bad.
it does. I don't understand why. And if I break my toe, I'm like, it's fine. Just tape it to the one next to it. It's fine.
Yeah.
It's the buddy system. It's got it. But stub
Yeah.
it? Why does it hurt more to stub it than it does to break it? I
Oh, I
don't
know.
understand.
Stubbing it just, oh, it makes me cringe. I just don't like
Yeah.
it.
I
It just,
walked around
ugh.
on a broken heel for 6 months. And the only reason that I even got it like x-rayed or anything was because I ended my basically all my foot muscles contracted super tight to protect my foot.
Yeah.
And I'm like, well, that's really annoying. And I feel like it's painful. I'm like, I feel like I stubbed my toe, but it's the underneath of my foot. I don't like it was the weirdest feeling, and I think my brain was like, dumbass, you're not listening to any pain that I'm sending you.
Yeah.
So we're gonna pretend you stubbed your toe, but it's the bottom of your foot. So I'm like, this is the weirdest thing. It was brutal. I hated it so much. But yeah, we have this weird pain thing. So when you go to the doctor and they're like, what's your pain level? And you're like, it's a 2. If you're autistic, 2 is about an 8. Heads up.
Mhm.
3 is a 10 and above. So just so you know.
All right. According to the Alberta Blue Cross, overlooking menopause is costly on all fronts, including an organization's bottom line, the global economic stage, and gender equity in the workplace. The message is clear. Ignoring menopause isn't sustainable. When employees going through menopause don't have the support they need, it can be costly for businesses due to factors like reduced productivity, symptoms like fatigue and brain fog,
I'm sorry, I like
symptom
brain frog better.
like what I'm having now, okay? I'm having a brain frog.
Ribbit. That's what we should just say. That's the new term, ladies. When you have brain fog,
ribbit.
just say
You have
ribbit.
ribbit. Oh, symptoms like fatigue and brain fog can negatively impact performance. Studies show that 32% of women said menopause symptoms affect their job in some way. Really? I don't know
What?
that word.
Oh my God. Increased
You,
absenteeism.
okay, I'm like, you don't even know that word.
I do.
But you
I
do.
was just when I said I'm like increased is
Okay.
probably not the word. She doesn't know.
Okay.
It's like, hang on.
Okay. Increased absenteeism.
Fuck me.
Absenteeism. That's what it says.
Abs Okay, listen closely.
Okay.
Absenteeism.
Okay. Increased absenteeism. The same study found that 24% respondents miss work in the last 12 months due to the menopause symptoms. High turnover. Without support, women may leave their jobs or reduce their hours, resulting in costly recruitment, onboarding, and lost expertise. When many women cut back their hours or leave the roles, overall productivity declines. Multiply that across sectors, and we begin to see the impact weigh on the economy, both nationally and globally in 2023.
No. Nationally and globally.
That's what I said.
Pause in 2023.
Oh.
Sorry, I'm like, wait.
I know. Sometimes I just like keep going.
No, I think it
Okay.
didn't shift on the page properly.
Multiply that across sectors, and we begin to see the impact weigh on the economy, both nationally and globally. In 2023, over 73% of women in Alberta experiencing perimenopause and 52% experiencing menopause reported impacting their working life. An estimated 27% increase in the number of working women aged 45 to 55 by 2040. Out of Canada's 20 million person labor market, 5 million are working women aged 40 plus, 2 million of which are working women aged 45 to 55. 3.5 billion in estimated annual losses in Canada due to unmanaged symptoms of menopause. And without adequate support, along with the 3.5 billion, we will see 540,000 lost days of work attributed. Okay, lost days. Okay, 540,000 lost days of work attributed.
Attributed.
Attributed to menopause symptom management.
You keep saying the same thing you said before.
It's attributed.
It's attributed.
Attributed.
There you go.
Attributed. Okay.
Yeah.
All right. I got it. We will see 540,000 lost days of work attributed to menopause symptom management, 237 million in lost productivity, 3.3 billion in lost income due to a reduction in hours and or pay or leaving the workforce altogether. 150 billion globally productivity losses per year from menopause. Many women are facing the difficult choice to step away from their careers right at the peak of their experience and leadership potential. This has real consequences for our teams and the future of workplaces. An estimated 1 in 10 women will leave the workforce due to unmanaged symptoms of menopause. 1 in 5 women believe their symptoms could affect their progression at work. In a recent study, almost 1 in 10 survey respondents, sorry, I guess not. I don't know. Oh my God. I need a nap. I just can't stop thinking about how I can't pronounce these words that I can normally pronounce.
Right? Sometimes it's just weird, like
Ugh.
reading it versus like
When
if you were
I don't know.
organically
It's
gonna
like,
say it.
yeah, and I'm reading it, but it's not the word. Like I'm reading something completely different
Yeah,
and saying it in a different way, and I'm like, but that's how I'm reading it, right? Like frog,
yeah,
like that's a frog to me, but it's really fog. You know what
yeah.
I mean? But to
Oh,
me, I look at it and
exactly.
it says frog.
I wonder if
Okay.
you got perimenopause.
I wonder
I'm
if
just
I'm
kidding.
like dyslexic of some sort.
It could be. It totally could be,
Right?
right?
Yeah. Okay. Where was I? Okay. In a recent study, almost 1 in 10 survey respondents had to turn down a job promotion or career advancement due to menopause symptoms, and some respondents even reported being fired. In Canada, women make up of just 20.5% of all board directors, 30.5% of elected federal government representatives, and 5% of CEOs. Companies with more than 30% women in leadership are more likely to do better financially than those with fewer women. Without making a change, we'll see an increase in gender pay and pension gaps. Interruptions in work or early retirement can reduce lifetime earnings and retirement savings, slow down our progress towards workplace equality. Without action, menopause becomes another systemic barrier that prevents women from advancing in their careers. Reduced diversity in the leadership teams, with fewer women moving up the ladder, organizations miss out on perspectives that better decision making and long-term success.
Sorry, you gotta read
This
that.
is all more reason. What?
Sorry, you gotta read that last bit again because the sound went funny. So start at reduce diversity.
Okay, reduce diversity in the leadership teams with fewer women moving up the ladder. Organizations miss out on broader perspectives that lead to better decision making and long-term success. That's all the more reason for companies to just not hire women,
Right?
right?
This thing really pisses me
We
off.
are a problem.
Well, I mean, we finally get through um the whole having babies part, right? Because companies don't necessarily want to hire women when they're having babies or like young moms, because if your kids are young, then when your kids are sick, it's usually mom that stays home. So stuff
Yeah.
like that have prevented women, like when people talk about like the gender gap with work, that's why, right? It's because women tend to stay home with their kids if their kids are sick. Women tend to focus a bit more on their kids. So sometimes things do lapse at work, whatever. It's not whether, like, I'm not saying it's right or wrong. It's just that's the reasoning why, right?
Yeah.
So women finally get to this point where if their kids are sick, the kid can stay home by themselves. The mom doesn't need to be there. We get to focus on our work. You get what, 10 years? And then life goes, bitch, now you got perimenopause. Like, what the
Yeah.
fuck?
Yeah.
like, no wonder women struggle in like career wise, right? Like
We
certain
make
career
all the sacrifices.
we do.
We do,
Yeah.
right?
And and I'm not saying like this isn't a, like I said before, it's not like a we are women heroes roar. That's not what I mean. But realistically, we women are the ones, like Sophia said, we make all the sacrifices so that we can
We
have
do.
the babies, so that we can repopulate the world, all that bullshit. And all we do is get kicked in the ass for it over and over and over
Yeah.
again. And
Yeah.
I mean, we don't want to have these symptoms. And I think in some cases, if it was a more talked about thing, and if people were not so like, if it wasn't so taboo, if it wasn't so like, oh, we don't want to talk about your dry vagina, like, that's not what people are saying. Like, we want you
Yeah.
to understand we're fucking tired, man. We need you to just not be stupid. That's all. We
Yeah.
don't need you to
Yeah.
carry our load. We don't need you to do extra stuff for us. We can manage. Just don't add to it. And that's a lot of the problem is that we're overworked, we're tired, we've done all this stuff on top of not sleeping, on top of all these symptoms, and then some jackass says shit like, "Do you need me to do that for you?" Because you're like, "No, we don't. We need you to not be a jackass. Don't
Yeah.
add to our load. Don't like take care of you and your shit and don't add to it because that makes it so much harder."
Yeah.
Right? And I don't know. I think there's a miscommunication when it comes to menopause. And I get I'm not actually in it, but I've got friends going through it and it's a lot. It looks awful and I don't want to be there. You know, like and I feel like there's sometimes that it's just we have enough shit on our plate and then it gets added to. And not necessarily that anyone means to, like sometimes it's we made a joke, we thought we were being funny, or we did, our typical man stuff. And again, I don't mean it, I'm not judging, I'm just saying like it's not helpful. You know, are you on your period? It's not helpful. Because whether yes we are or no we're not, what does that matter? Right? Like just be there, be supportive, take care of your own shit and don't add to ours. I think that's the main thing. I think women, especially at work, they don't need shit added to them when they're going through all this shit on top of it. It's not that we need help. It's not that we need exceptions made or rules bent or whatever. Just don't add to it. Don't make it worse.
Agree.
Agree. Sorry, I was just watching my son down in my kitchen, shirtless, eating a jar of Nutella with a spoon.
Uh, being like, you're gonna piss
Come here,
off some woman at
come
some
say
point.
hi. Come say hi. Yep, yep,
Because if we fucking did
probably.
that,
That
we'd gain
woman
an
will be
extra
me.
20 pounds.
If it's
Betcha.
not the Nutella, it's the tub of peanut butter. Like he just, I go through so much Nutella and peanut butter. I go to open it and make a sandwich for someone, and I'm like, oh my God, where's all the peanut butter? Where's all the Nutella? Yeah, he ate it all
See, and
with a
that's
spoon.
adding to the shit that I'm talking
That's adding
about.
to the shit that we're talking about.
At
Yep.
least a heads up. Hey, mom, I think we're out of peanut butter because I just ate it
Yeah.
all with a
Oh,
spoon,
that would be so nice. Instead of opening an empty jar, it
right?
would be so nice if he would tell me, hey, I ate it all. Instead,
And
he puts it back empty and giggles about it because he knows I'm gonna lose my shit.
or when you lose your shit and they're like, "Why are you so mad? It's just peanut butter."
Yeah.
I ended up buying all these Tupperware containers for our cereal. And when I first bought them, like their Tupperware is like actual Tupperware brand is expensive, right? But I
Yeah.
wanted the good shit to keep the cereal fresh because there's nothing worse than gross, stale, yucky cereal. And we eat a lot of cereal in our house. Judge, don't judge, whatever. I'm not changing for nobody. But anyway, so I bought all these expensive Tupperware containers, put them in the thing, and my husband was like, "What'd you waste all your money on that shit?" I'm like, let me fucking explain to you why you wasted your money on the Tupperware. He's like, why did I buy it? I'm like, dude, because every time I would go to have a bowl of cereal, it was empty. But I hadn't bought cereal because there's all these boxes in the cupboard. So I assumed when I wrote the grocery list, we had plenty of cereal. So I didn't buy any. And then I go to have cereal and they're fucking empty because no one can throw out the fucking empty cereal.
Yeah.
Why is that so difficult? And they're like, well, there was a little bit left. There's like 5 crumbs in the bottom. That ain't a bowl of cereal for nobody, okay? And if there
Yeah.
was enough, why did you open the other box before finishing that one? Because there wasn't enough for a bowl. So why is it there? So yeah. So we have, but that's the shit I'm talking about. When I'm talking about don't add to our plate, that is the plate that you're adding
Yeah.
to. Like it's those simple things which we get told if we say anything, we're nagging, we're whining, we're just being a woman. No, no, it's because you ate all the fucking cereal and didn't take out the box.
Yeah.
Simple common sense shit that I get
I
it.
think it's just a male thing because all the males in my house do it.
Exactly. And
All
they
of
don't
them.
think about it. And I
They
know they're
put
not
back the empty milk carton, the empty juice, the empty cereal, the empty peanut butter.
right.
Always.
And
They
I know
always do
that
it.
I assume they don't do it to be like, I am going to be such an asshole and piss her off and put this. I get that's not why they do it. They don't think about it. And that's fine. But why is it okay for them not to think about it and not just be, oh, it's just a guy thing? But we get annoyed by it and now we're nagging. Now are you on your period? Because you bitched about the cereal box? No, you fucking dickhead. I'm not on my period. You caused all this shit because then no one has cereal because we didn't buy any because we thought it was full or whatever, right? Like that's the shit that when I say don't add to the plate, that's what I'm talking about. If some poor guy accidentally is listening to this episode, they will never listen to us again, and that's just fine. Okay. Oh my God. Sorry. I'm like, I can't talk. I'm recording. Ping, ping, ping. Okay, okay. Fuck. Do you think I can't talk? I'm recording means? Okay, so as usual, I went to my new friend Reddit
This
because
is, this is a lot of Reddit.
it is. We don't have to read it all, but some of it is actually really important, I think, because these are women that are going through or have gone through peri or full menopause. And because that's what we want to hear. We've heard all the like technical, this is what you feel, blah 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 blah. But realistically, we know that shit's written by a man who maybe asked a woman once or twice, right? Like that's the man shit. Now let's hear from women who have gone through it. So there's a post on Reddit that I came across and it caught my attention. Just a reminder, perimenopause is a dangerous time in a woman's life, especially for those of us already prone to depression and anxiety. There isn't nearly enough research out there related to women, mental health, and midlife changes. That doesn't mean what you're experiencing isn't very real. You'll get through this, and you are not alone. Edit. This is not me, by the way. This is the person, or this is the thread on Reddit. I wrote this post yesterday after talking to a man who lost his wife to suicide. She was perimenopausal and had no one to talk with about what she was experiencing, who was also going through it. So please, everyone, talk about this or talk about this stuff. Don't be ashamed, embarrassed, or polite. There is no reason for us to slip under the radar just because our boobs aren't where they used to be. Because one thing I did find was that it's a high divorce rate is when women are in menopause or perimenopause, and suicide rate for women, which is horrific, really, because it's not us, it's our bodies that are fucking with us. So some replies. Individual tour 1209. Honestly, thank you for this. I'm a psych provider, and I do this for a living, and I am an absolute disaster right now. I can't believe how profoundly this is affecting every aspect of who I am. I know how to reach out to colleagues. I have really supportive people who try really hard to understand. I can't imagine facing this without this knowledge and support. I feel insane. I'm not insane. I feel like I am. So that's an expert who also feels this. So what we feel and don't understand what we feel, experts are going through the same thing. So looking for the 411. This is such a difficult place to end up with no warning. When I felt crazy, and during that time, I became a completely different person. I didn't want to reach out to people, and I hid everything I was feeling out of fear that I would be committed. It was torture. I got I got in to see the right doctor just in time. If I hadn't, I may not be here today. Thank God there are ways out of this. This insanity is only temporary. So Lazy Composer 7153, absolutely spot on. What I find so funny about women are the ones who say, "Oh, I have no problem with the menopause." But they are on antidepressants or sleeping tablets. I remember my old boss would say I had no problems with the menopause, as I just put it in the back of my mind, and before I knew it, it was over with. Haha. She was a functional alcoholic with her hands shaking every day, who would always be stressed, and that's how she coped with life, by getting pissed each night. Because she was that stressed. She would make me feel nervous, and I can't stand bullshitters. Amateur time traveler. We need to talk about this more. I experienced a full-on psychotic episode that wrecked my career. Sorry, that wrecked my career and reputation, and horrific suicidality. The only thing that helped was getting on HRT. Age 45 to 54 is the highest rate of suicide for all women. I think there are some lingering fears of raising the hysteria specter, but we need to talk about it. Suicide prevention sure isn't. All first episodes psychosis programs are for youth, and all those menopause influencers sure as hell aren't talking about any of this. Thanks for raising this. Oh, another thing is that no one talks about is how if you have a history of childhood trauma, it makes menopause pretty hellish, or at least worse than someone without those life experiences. Sorry. Silver lining 1212. OMG, my disability leave coincides with the first month that my period stopped. Anxiety, depression, and ADHD diagnosis. Imagine not knowing that you have ADHD until you are past 50 years in age. Looking back, I had a number of indicators, but hadn't been diagnosed because I was functioning well. Now my brain is shot, and I can no longer focus or deal without meds. I was so bad in the beginning that if I read a paragraph, I couldn't tell what it said. My comprehension went out the window. I took a beating from peri-menopause, and I am still trying to regain my balance. In menopause, I'm 3.5 years into disability leave without meds. I would be a basket case. I'm functioning better now, but I am a shadow of my old self. What really pisses me off is that they don't know what my hormone levels were prior to menopause. I mean, why aren't they checked for every woman in their mid 40s? It's ridiculous that this was never suggested to me by my doctor, who is also in menopause. If I could punch that bitch, I would. I've now switched doctors, lol, but that's a whole other story. That's the thing. If you don't have a base level of what your hormone levels are prior to entering perimenopause, they don't know what you should be at. Because it's not like everyone's limits or levels are the same. So every individual has their own base level. So I would suggest women in your 40s, if you haven't yet, go have your hormone levels checked. It's just a blood test, they will check them. And then you have a baseline. You have something to go off because if you don't, Who the fuck knows? Okay, Cash, you can read here because this thread was fucking wild.
Next one, calamity gin. Symptoms you didn't know were caused by perimenopause. Perimenopause. Let's share all the symptoms we didn't realize were caused by perimenopause. You know, the weird ass stuff that made no sense until someone explained it to you, or you stumbled on a medical study, an article, or a fine mentioned it. What's that supposed to mean?
Oh, I think this is like,
They wrote it though, right?
yeah.
Okay. I'll go first. Fasciitis. Why on earth would the band of a tough connective tissue across the bottom of my feet betray me just because I ran out of estrogen? Well, because estrogen modifies how our bodies store fat, and when the estrogen for miss and when the estrogen for missing, our feet lose some of the fat padding the bottom of our feet. I had a bad bout start back in September, and I thought it was caused by 3 days of wearing the wrong shoes. I was quite ready to see the doctor. I wasn't quite ready to see the doctor about it, but I was stretching my feet, wearing shoe inserts, and taking an anti-inflammatory, but still having to hold on to the wall when I got up in the morning. Then, a couple days ago, someone mentioned it in a thread, and I screamed, son of a bitch. This morning, I put a little estrogen cream on the soles of my feet, and I'll be damned. It helped a lot. Guess I'll be smearing my feet every fourth day, just like I do with some other bits. What have you learned?
Like, who the fuck would have thought that? And so one of my friends that has or that is in perimenopause, she suffers really badly with plantar fasciitis. And when I read this, I was like, what the fuck? So I messaged her. I'm like, hey, did you know your foot issues could be caused by your perimenopause? And she had no idea. But like, this is the shit that doctors should know about, right? Like, why aren't they? Because she goes to the doctor all the time for her foot, and they've never said, like, hey, why don't you put some estrogen cream on the bottom of your foot? Like, this is why people need to talk about this shit. All your fucking weird ass symptoms, you need to be telling people. I get it's embarrassing. I get it feels weird, but it's other women. How many people have seen your vag when you've had kids, right? Nothing is embarrassing anymore. Like, some of you pooped during childbirth. How can you be embarrassed by anything at anymore, right? Like, anyway, so yeah, so here, continue with some of these crazy fucking symptoms.
Crunch Cheap 56119 said itchy ear canals. Aunt Chicken Pepperoni said heightened sense of smell. There's a lot of awful odors in this world. Sweet potato pie time. Misophonia.
Oh, I was gonna look up what that meant. Keep going, I'll look it up.
M_Watkins. Vertigo, dry eyes, frozen shoulder, plantar fasciitis. I've had all these things and never realized they were related to menopause. Big Rise 7340. Phantom smells. I randomly smell smoke or something weird.
Okay, hang on. So misophonia is the hatred of sound.
Oh.
Okay.
So I'm guessing, like myself, it's when, like, if you hear people chewing when they're eating,
Hmm.
unless it's a cute little dog, dogs can make that chewing noise all they want, but if a person doesn't, die! Like, it's brutal. But I'm guessing that's kind of what they're talking about. Sorry, continue.
New Life 21. Does anyone have issues with their eyes? Not dryness, but stinging pain like something is in them, but there's nothing there? All out of cake. My feet were hurting more and more until it dawned on me shoes don't fit anymore. My feet went up a full shoe size. What the hell? Now none of my shoes fit. Mentioned it to a friend in the same boat. She was having the same problem. Mentioned it, Mentioned it to my stepmom, and she said, "Yeah, that happened to me too at your age." Another fun surprise to add to the pile. Pinecone 71, runny nose.
Like, what the hell?
EA positive 2. Anybody else have itchy nipples? I mean, every inch of my skin, head to toe, seems to be dry and itchy, but the nipple itch. Arr.
Ah! You didn't read that right. Sorry.
Local Blackberry 317. Related to clumsiness, I drop a lot of things and sometimes misjudge doorways. Baby Nurse 70. Homicidal
No,
thoughts.
homicidal.
Homicidal thoughts solely about my husband. They were extremely disturbing to me and him. Luckily, my doctor got me on HRT fast and it helped fairly quickly. That poor husband.
Although, was he not letting you know that the peanut butter jar was empty?
Yeah, right.
Tia Grow Mama. Sensitive scalp, like when you wear a tight ponytail too long, frozen shoulder and vaginal atrophy. If men experience penis atrophy the same way, billions would be invested in a cure.
That's so true, though, right? Like, doesn't it make you wonder if men went through menopause instead, would we have more information? Would there be so much more put into it, right? Like, because men have erectile dysfunction, right? They can't get hard. We now have a pill to fix that.
hmm
What? Like, that's not all men. That's just some men, but they've had a pill to fix it for decades. All women go through menopause. Where's your fucking magic pill?
hmm
We don't get it. But just because a poor man can't have sex properly, they get milk. God damn it! I'm a
So
little
what,
bitchy about this.
so what can you do if you are suffering symptoms? First step is go to your doctor. You may have to advocate for yourself. Ask for a referral to the MP Power or Empower Menopause Clinic, the IUD, and Northeast Women's Clinic, or Evolve Well Integrative Health Center. Pharmaceutical treatments for perimenopausal symptoms focus on hormone therapy, HT, for hot flashes, irregular cycles, and vaginal changes using estrogen with progestin,
Yep,
if you have a uterus,
yep.
or the new non-hormonal drug Vibegron, Viosan, Vioza, plus options like SSRIs/SNRIs. Example for mood flashes. Gabapentin for hot flashes and sleep. Butynin,
Sure.
or uh, Ospin. Okay, these are medical terms. I have no idea. Whatever medicine for vaginal dryness. Oxybutynin. I'll take that one. Aiming for symptom relief with the lowest effective dose, tailored to individual risk factors.
That's the thing. So they have some pills, but there's a lot of risk factors that go along with it. I know I was going to look into all those risk factors, but honestly, I feel like it would be one of those like the Google your symptoms things, right? Because if you like when you're watching TV and a commercial comes on back in the day, a commercial would come on for like a new pill and it'd be like list of symptoms and all the symptoms are 10 times worse than what the pill is meant to help with. Like some of them it's like diarrhea. Well, the medicine is for diarrhea, but it could cause di like, do you know what I mean? There's just all these awful symptoms. And I feel like it's would be the same with these. There's going to be lots of symptoms, so you kind of gotta talk to your doctor, figure out what's worse, the symptom or the possible side effects that can come with the medication or what you're suffering through. Either way, ladies, it's gonna suck. It's gonna be an awful, awful time in your life, but we'll get through it. Yeah, I mean, nobody ever talks about it, right? Like, I don't rem I mean, so my mom is 70. I don't know. She might be 70. She might be more than 70, but whatever. She's never talked about menopause ever. My grandma never talked about it until like way later. And then, but even then, like it would just, you'd hear them say the word, but they would never say anything. Or they'd be like, oh, I have a hot flash. And that's it. Okay. Like, give your fellow woman a heads up of the nightmare that they're gonna go into, right? Like I feel like I don't get why women are so hush hush about it. Like maybe it's a generational thing, but I don't know. It's time to talk about it, people. Maybe it wouldn't be so bad. I don't know. You guys are being very quiet. So maybe that's why nobody talks about it.
Well, it's
It's
hard
scary.
because we don't understand it yet,
Yeah, no, for
right?
sure.
So maybe when we're in it, we will have a better understanding of it,
Yeah,
but we're not in it. So I can't really
for
put
sure.
in my 2 cents, right?
But I mean, don't like, did your mom ever say anything about it?
So my mom never said anything. The only thing I remember, and we live together, right? Like she lives with us.
Yeah,
The only thing I ever heard her talk about was the hot flashes. And she was never on any hormone replacement therapy and she was fine. Like everything was, that's all she had was hot flashes and everything
yeah.
was fine. So, and I asked her about it. I remember asking her about it and she's like, no, she's like, I don't need anything. She's like, I'm totally fine. So
But I wonder
everybody's
then,
different, right?
yeah, but I wonder if she had symptoms that she didn't realize were part of menopause. Because if we don't know enough about it now, guaranteed our parents didn't know enough about it, and their parents didn't know enough
Right,
about it, right?
right.
So,
I don't know. I lived with her, so
yeah.
I'm sure I would have seen something.
But it depends if your mom is the type to say, if, like, is she gonna be like, oh, Sophia, my nipples are itchy? Right?
No,
Like, do you know what I
no,
mean? So, and, or like, my
no,
ear
not
canal
happening.
is itchy, or whatever, right? Like,
Yeah.
I just think that maybe people, like our parents, didn't talk about it because it was embarrassing or whatever. I mean, my mom never talked to me about my getting my period. That was a
Yeah, no,
wonderful
neither did
surprise,
mine. Yeah.
right? Like,
Yeah.
so if they're not
Same.
telling us about that when we're a
Yeah.
kid, when we
Yeah.
honestly have no idea, like I was 10. We hadn't even had sex ed in school yet. It
Yeah.
was a fucking shocker.
Yeah.
And so like what do you I guess we can't expect more. We can't
Yeah.
expect them to open up about childbirth or perimenopause or menopause or whatever, right?
Yeah.
Yeah, it seems terrifying. But I mean, everyone gets through it, so I guess it depends how your symptoms affect you, but hopefully everyone's doing okay. Check in with your older friends. See, I have a couple of like good friends that are like 10 years younger than me. I'm gonna tell them everything. Here it comes, Stephanie. You're gonna hear every
Oh,
awful.
yeah.
I'll be like, my nipples are itchy. My ear canal is also itchy. And the dryness. Oh my God. Maybe I won't share that one, but
Right?
it's me. I'm kind of an open book. I say shit without thinking. She'll probably be aware. Poor friend. But I don't know. People got to talk about it more, man. But it makes you wonder if it has such a huge effect on the economy that nobody really thought maybe we should start looking into this, how we can help these women out. I guess we just suffer in silence.
Yeah, I
I'm not,
guess.
I am not going to be silent. I'm telling you that right now. If I'm suffering, the whole fucking world's going to hear about it. Uh, well, that's it. That's it on that. So that's it for Moms on Mics this week.
Don't forget to follow us on Instagram at Moms on Mics Podcast, on TikTok at Moms on Mics, and join our Facebook group, Moms on Mics.
If anyone has any topics you would like us to cover, or if you have any questions or suggestions, you can email us at momsonmics@gmail.com or submit through our website, momsonmics.com.
We would also appreciate it if you could rate and review us on whatever platform you're listening on. It really helps the podcast move up on their charts so it gets more exposure. I hope you join us again next week. Goodbye.
Bye.
Bye.